Okay, so I've had a lot of questions on this one, so I thought I would do a little video to explain what it is. So, what is a stem cell transplant and how does it work? Let's dive into it. Stem cell transplants and how do they work? I think before we get into how a stem cell transplant works, we need to discuss why a stem cell transplant is necessary. Typically, it's for blood cancer patients or particularly relapsed blood cancer patients. However, it also could be for other blood disorders such as aplastic anemia. But normally, it's for relapsed blood cancer patients with cancers such as leukemia or lymphoma. In order to treat these cancers, patients require high-dose chemotherapy and or radiation in high doses and or immunotherapies. And often on top of that, in order to be fully cured, they need a stem cell transplant. And this is done in order to avoid another recurrence of said blood cancer. Now, all these therapies can be really detrimental to the patient's immune system. It basically destroys their immune system cells. Or should we rather say, it basically destroys their stem cells, which are what produce new immune system cells, which is why we need to do a stem cell transplant. So now that we understand the why behind it, let's look at the stem cell transplant process. So one way is to take the patient's healthy stem cells and to process them, and then give the patient high doses of treatment and then reinfuse their own stem cells again, so that the person's own immune system can get back on track. This method is called the autologous stem cell transplants. It does come with risks though, as in the stem cells themselves that were originally extracted, there could be just 1 or 2 cells of cancer. So by giving them back their own stem cells, you could actually be reinfusing the cancer into the patient, which means they would be starting from step 1 again. That's not to say that this is a bad method or an undesirable method. Another method is to collect from a stem cell donor, and this method is called an allogenic stem cell transplant. By the way, an allogenic stem cell transplant is the route that I'm going. Allogenic stem cell transplant basically means that it's from a high percentage HLA matched donor. By the way, this is not blood type dependent. This is done by taking blood from the donor and processing it to extract the hematopoietic stem cells, which are particular cells in the donor's blood, which can then give rise to new immune system cells in the recipient. After the transplant, which would have been depleted by the high-dose treatments that the patient received prior to the transplant. Once the stem cells are extracted from the donor, the patient is then given the high-dose chemo and or radiation. But typically, it's both high-dose chemotherapy and full body radiation together, which should kill their stem cells and hopefully all of the cancer cells as well. Once the patient is then stabilized, the stem cell transplant can then take place. Yay! This is generally done via infusion through what is called a HIC line, which is sort of like an IV canal, except it's in the chest or in the arm here, floating through to the chest. A HIC line is beneficial because it can be there for up to a year, and it's less prone to infections, so the patient can receive treatments through the HIC line as well as have blood samples taken to be tested on a repeated basis. after this, hopefully the donor stem cells will take hold in the patient's bone marrow and give rise to a new immune system. Now, there are possible side effects like graft versus host disease, which in very, very simplified terms could be varying levels of the transplant being rejected. But that's for a whole other video where we'll do a deep dive. For now, that's just a basic breakdown of the stem cell transplant process. If you want to know more or you have questions, please drop them down in the comment box and I'll be happy to get to any of your questions or make more videos on what you want to know. So that's all for today. I hope this helps explain a little bit more about the stem cell transplant process and answer some of the questions that you may have had or been asking me. Have a good day. Love you, unicorns. Bye. Please like and subscribe, and if you're not already registered, please think about registering for the Bone Marrow Registry to be an international bone marrow donor. Thanks and have a good day, y'all. Bye.